Fitted frames. Choose your pain. So the first part of glasses is the lens, and most people would probably say the most important part, but as those of us who wear glasses know, the frame is super important. I mean, I'm not talking on the aspect of style or your look, right? But I'm talking about the fact that, this frame is what actually goes on my head and interacts with my head and can cause me an awful lot of pain. I don't know if you know this, but many people with glasses have these permanent indentations on their nose. Sign you wearing glasses for a long time. Also probably means that my glasses aren't too light. Maybe some would even say they're not seated properly. But guess what? It's a choice. But not really a choice that is often given to me. See, when I go and say, hey, my glasses don't fit very well, they're like, okay, let me adjust them. Let me see if they're straight. They put them down on the table. And if they're straight on the table, that means they're even, level, whatever. But does that mean anything to me? What if one ear is higher on my head than the other? Does the table replicate that? What if my nose is off-centered? What if this or that? What if I'm an individual person? Which I am, and which I would say most people with glasses are. Individuals with asymmetric, misshapen faces, right? The thing is, they do try to adjust it. You're like, hey, it falls too, okay, let me try to make these tighter so it doesn't fall down your nose so much. But there's consequences to these things, right? So I went back and told him my ear hurts. But guess what? He adjusted it, but the more important thing he was concerned about was that it was falling down my face. So I think he tightened both of these. And I want to say the left one is still pretty symmetric to the right. Even though my left ear hurts, maybe you should make it looser. Would that work? How does that work? For me, there's also a dilemma. Do I want my face to be even or to be crooked? Because my old glasses fit very well or very comfortable. I didn't feel them at all. And guess what? My face was crooked, according to my wife. Is it now even? Is it good to be even but have my ears hurt? Is that a trade-off I'm willing to consider? We all have different preferences, belief systems, what have you. And we all accept certain things over other things, right? Some people are concerned a lot about beauty and appearance. They'll take pain if it trades off with a more beautiful, acceptable appearance. Some people don't really care how they look. They just want functionality. You know the people with those things behind their glasses so they don't fall off? Or the goggles for basketball? It's different for every person. I think one issue is miscommunication or lack thereof. Do you tell the person adjusting your glasses what I can accept in terms of pain, what I would prefer to have? They have their idea of what everybody wants, but you may not fit that everybody. They don't ask. We don't offer. Wonderful, right? Nobody gets what they want. Myself, I'll gradually adjust my glasses however I wish to fit my face better, whether it be crooked over months, which was in the last case, whether it be bent out of shape, whether it be too low, too high, etc. I mean, regardless of whether or not they adjust it, by me pushing it down this way, pushing it down that way, trying to twist it myself, I will adjust it anyways. It may take me a long period of time. But basically, I have preferences and I'm going to get what I want. And so it's much better for the person at the eye shop to just ask me, so, this may hurt. The pain may go away as you get used to it, or it may not. But you could have better, level, equal faces. Would you like that? Or would you prefer to be more comfortable at the risk of falling down where you have to push it up more? You know, the nerdy push up your glasses thing. What do you want? Tell me so I can make it your way, right? Isn't that better? After all, who's wearing the glasses? Whose life is this? Whose face, whose ears, nose is this? Me. think there's a lot of lessons we could learn from my trip to the optometrist. But how we interact with patients as doctors. We may laugh and joke that it's just glasses, not so important. But such is most things in life, right? Not so important to one person, but to the patient, very important. All these little things that don't matter, very important. Why don't we find out more about it? Why don't we figure out what they want? Because they're going to do it their way anyways, right?